Hi again, I'm Imanuel. I wanted to tell you about what I'm learning this week in the Transform Fundamentals program. It is all about the thyroid. It is an immersive, in-depth look at the thyroid. And it's been very eye-opening for me because when I first got my blood test results back for my thyroid levels before I started learning about the information this week, I thought I was good. I mean, I thought my levels looked great. They were all in range and I didn't have any thyroid problems. I was wrong. I've learned this week that I actually do have a pretty serious problem with my thyroid that most likely will require medication or some kind of supplementation at the very least. TSH, for example, maybe you've had that tested before. That's the level that I always got tested for when it came to thyroid health. Well, I learned this week that that's not really the level that we should be looking at when it comes to how much thyroid is your body producing and how much active thyroid do you have. I learned that I have a major problem with converting thyroid into the active form that can be used. And so we're going to need to address it. And I look forward to speaking with Dr. Maggie about what she thinks I should do to address it because I have a feeling I know what to do, but I just need to confirm it with her. It's going to require medication for me, I'm pretty sure, or at least supplementation. And you know, it's never great finding out that you have an issue, but it is a good thing overall because this module has a whole big thyroid checklist of symptoms that you can experience when you have thyroid problems. And boy, I check off a lot of these boxes. So great, if I can get some help and some support for my thyroid, I can get rid of some of these symptoms. I mean, that's the goal, right? So this is a good thing, and I'm happy to have this information. The other very serious thing that I learned in this program is this week. You know, 2 years ago, let me back up, I was told by an endocrinologist that, oh, we think you have a little goiter or an inflamed, enlarged thyroid, and they did an ultrasound. I was visiting the endocrinologist for something totally separate, and they found a couple nodules on my thyroid as well, but acted like it wasn't a big deal, and sure, we can just monitor it every now and then. What I learned in the thyroid week this week is that no, I have actually an autoimmune attack against my thyroid, creating these problems. And why does that matter? Well, it puts me at a 10 times greater risk for cancer. So that's very serious. So now I know what do I need to do to protect my thyroid and to monitor it. I absolutely need to be getting regular ultrasounds to monitor these nodules. This is life-changing information and maybe life-saving information. And that's not hyperbole. What I learned this week may actually save my life. So I'm very thankful that I went into this week thinking it wasn't going to impact me, but it did in fact impact me in a great way. And it's gonna really help me out. So I look forward to presenting my results to Dr. Maggie to get her opinion as well.